Hello, everyone, and happy Friday. Welcome to another Friday with Having Coffee with Dr. Munné. This is the time where we share coffee and we talk about your tooth health. Today, we're going to continue with the topic of prevention, and we are going to know how to use the electric toothbrush. Thank you so much for another session, Dr. May. Welcome.
Good morning, Adrian. Good morning, everyone. Thank you again for tuning in. And here we're going to continue. You know that we've been discussing oral hygiene and how to maintain, right? How to prevent oral disease. I think that's the best thing to keep things healthy, not having any pain or discomfort, and it's cheaper also in the pocket as well. So I think that that's important. So we already talked about how to brush using the manual toothbrush, and you guys can do a perfect job with a manual, so you don't need to have an electric toothbrush. But I think that the electric toothbrush has some advantages sometimes over the manual, and we're going to talk about them right now. So as I mentioned, with the manual you can do a perfect job, and you can do a good job with both, and you can do a bad job with both too if you're not using them properly. So that's why knowing exactly what to do is like, knowing how to drive the car, right? So
That's
that then
correct.
it's going to take you where you want to go. So the electric toothbrush has some advantages because it has a bigger handle. So especially older patients might be easier to hold it than the little tiny brush. That's always like harder on the hands. Is also more manageable, because it's got a little bit of weight to it, and but they're light still, so it's not going to be hard to actually hold. And since it's got motion, so it requires less on our part, let's say, on how to direct the brush. So, and the bristles and the vibration on the brush, they also have what's called working by capillarity. And capillarity is when you have, like, two bristles together, that the vibration, it actually has like a suction motion. So that suction that does, it actually works at removing the plaque from the teeth. So I'm going to demonstrate right now. If you have an electric toothbrush, this actually has a round, and I'm not going to recommend anyone in particular at this point. I just want to make sure that you can have the one that's looks like a regular brush. I particularly myself like better the round ones because it's easier, it fits patients that have like a small mouth or their geigers. Is a smaller brush that can fit in, especially under in the between the tongue and the lower teeth. That's an area that a lot of patients, is like a sensitive point. They don't like to have the brush right there. So having a smaller brush kind of helps them, you being able to keep the brush there as long as you're going to have to be successful with your home care. So in order to start, we're going to start, like we do with the manual, always start in the same place and just kind of follow the same routine. That way you just kind of develop a pattern and you make sure you don't forget anything. You should be brushing for like about, 10 minutes. I know that a lot of you are gonna go, "What, 10 minutes? The brush says 2 minutes." No, the brush doesn't say 2 minutes. The brush has a 2 minute mark. It just tells you it's 2 minutes, but you should brush for a lot more.
Mm.
Otherwise, why are we still having so much dental disease? Why people continue going to the dentist? Why we do a filling and then we need a bigger filling, or we cannot control periodontal disease? And it's because we are not successful 100% on removing the cause of that decay and the cause of that periodontal disease. So you're going to turn on your brush. There's different settings on the brush. The brush that I'm wearing, that I have here right now, has the programs right here, and these programs are going to kind of change the motion. There's a program that has a feather, and that feather means that the motion is going to be a slightly less. I personally think that we should be brushing with the least, let me turn it off right now,
Mm.
with the least amount of pressure possible. So everything that we do, that try to tone it down and just lengthen the time. That way it's going to be less abrasive and less traumatic. So you want to brush with the program in your brush that's going to be the slowest or the lightest, or the milder. And your brush might have a timer or might not, I don't know. If you have one that has a timer, it's kind of handy. Some of them have really like programs on an app that you can, it tells you exactly like how to brush, and you can customize it. So it can get really very sophisticated too. So but it doesn't have to. So you could just get a simple brush, and you're just gonna place same thing as the manual. Do not wet your brush. It's not necessary. You have plenty of saliva and wetness in your mouth already. You're gonna place a little pea-sized toothpaste on top of the brush, and that's going to be sufficient. You don't have to overflow, make a mountain, like a 3 layers of ice cream. All that not necessary. Just like a little piece size right on top of your brush, and then you can start brushing. That way you're not going to foam as much, and if you foam a lot, just make sure you spit out, otherwise it might make you gag. So we're going to start with a brush. Let's turn it on in the same place, and you're going to place it on the tooth, kind of angling the bristles towards the gum. So I don't know if you can see this, but you want to angle the bristles towards the gum. So you want to have those bristles kind of trying to get in between the gum and the tooth, and you're going to keep it there. So the tendency for patients is that they just start brushing, and they start kind of going all over and up and down and all over. And when you do that, you're brushing a lot, but you're not brushing anywhere enough. So we need to have more like a, 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 a program on how we're going to do it to really allow, allow the plaque to be eliminated. So you're going to hold it there, and you're going to hold it there. You're going to count 15, and then you're going to make sure that you're just getting in between the gum. Try to get in between the tooth and on the back of the tooth. So you're going to angle the toothbrush towards in between the teeth and on the back. And you're going to keep it counting on to 15 in one tooth. Once you're done on that tooth, you're going to go to the next tooth. And you're going to do the same thing. You're going to angle it. You want to angle it towards the gum, keep it there, and then angle it a little bit to go in between the teeth this side, and angle it a little bit between to go to the teeth this side. You can also do a stroke down. Okay, so you can also do that. A stroke down depends on your teeth. If you have a lot of gum recession, you might have a long tooth, so you might need to go up and down a little bit. If you have little tiny teeth, then you might just need to stay there. So just kind of, person by person might be different. You're going to do that, and you're going to do that in all your teeth. In the inside of the mouth, you're going to do the same. You're going to angle it towards the gum. You're going to keep it there, and then you're going to go a little bit behind the tooth and a little bit in between the teeth, and then you're going to stroke down. For the chewing surfaces, you're going to keep it like that. Keep it on the tooth, kind of do a little vibration back and forth, and then the next tooth, a little vibration back and forth. But you have to be there. I want you to count 15 every time, tooth by tooth, one tooth at a time. Remember, we said that last time that we talked about oral hygiene with a regular brush. We want to do the same thing here. For the bottom, you're going to do the same. You're going to start on the same place, and you're going to follow the same routine. You're going to go tooth by tooth, one tooth at a time, count 15. You want to angle the brush towards the gum, making sure that the bristles get towards the gum. Then you're going to go a little bit behind the tooth, in between the teeth, and stroke up. And you're going to do the same thing here inside the mouth. I'll tell you that most of the times where all the disease is inside the mouth, so on all the inside areas, is where patients usually have more inflammation and more problems, and also in between the teeth. Next time we'll talk a little bit more. We talked about flossing last time. Next episode, we're going to talk about another technique of cleaning in between your gums that instead or in addition to flossing can also help your oral hygiene. But I hope that you practice this, rinse your mouth thoroughly, and make sure that you do that twice a day for like 10-15 minutes, and you tell me how you feel.
All right. Thank you so much, Dr. Munné, and thank you guys for watching. Everyone, don't forget to like us and follow us on our social channels. We have content every Friday. We try to connect with you every Friday morning, and we have all of these shorts and videos about the different topics we've been covering for for the weeks in the past. And we on YouTube, TikTok, Instagram, Facebook. Do not forget, we are also connecting on our website, and it is Healthy Gums number four, number four, all healthygumsforall.com. Don't forget to go and know more about the practice, know more about the services, and please give a thumbs up on our channels. It's very important for us to know that you like Dr. Munné's content, the content that we are able to bring to you every week. And if any questions, just leave them on the comments below. We will love to go and read each of them. Thank you so much.